Today we're diving into an essential topic in gynecologic ultrasound, the normal endometrium and how to properly measure it during different phases of the menstrual cycle. If you're new here, I recommend watching my previous video on the normal uterine ultrasound first. The link is in the description below. Section 1. Introduction to the endometrium on ultrasound. The endometrium appears as a bright echogenic line in the center of the uterus, but did you know its thickness and appearance can vary significantly throughout the menstrual cycle? Let's go through a few ultrasound images to understand this better. Section 2. Endometrium during menstruation. In this first image, you can see a thin echogenic line. This represents the endometrium during menstruation. It typically measures between 1 to 4 millimeters. You may also notice some fluid in the cavity. This is completely normal during menstruation and is usually just blood products. Section 3. Proliferative phase, the trilaminar pattern. Now, in this second image, you'll notice 3 echogenic lines in the center. This classic trilaminar pattern appears during the late proliferative phase. The outer 2 bright lines are the basal layer. The inner hypoechoic areas represent the functional layer. The central echogenic line is formed by the opposed inner layers of the endometrium. By this phase, the endometrium can grow up to 11 millimeters in thickness. Section 4. Secretory phase. Take a look at this next image. Here the endometrium appears uniformly echogenic. The trilaminar pattern is no longer visible. This happens during the secretory phase, when increased stromal edema and vascularity cause the functional and basal layers to have similar echogenicity. This results in a homogeneously bright endometrium on ultrasound. During this phase, the thickness may reach up to 16 millimeters. Section 5. How to measure the endometrium correctly. Endometrial measurement should always be done in the sagittal plane, perpendicular to its long axis. Make sure the entire endometrium is clearly visible. Here are 2 comparison images. The lower one is incorrect. The uterus isn't in a true mid-sagittal plane, and the full endometrial stripe isn't visible. Measure the thickest part, including both the anterior and posterior layers. In some cases, you may see fluid separating the anterior and posterior endometrium. In such cases, measure each layer separately and add both measurements to get the total thickness. Section 6. Special cases. Prepubertal endometrium. Appears as a thin central echogenic line, as seen here. Postmenopausal uterus. Also has a thin central endometrium, usually less than 4 to 5 millimeters. If a postmenopausal woman presents with bleeding and the endometrial thickness is under 5 millimeters, the most common cause is endometrial atrophy. However, if the thickness is over 5 millimeters, consider endometrial hyperplasia or carcinoma and a biopsy is advised. For asymptomatic women, a biopsy is generally recommended if the endometrium exceeds 10 to 11 millimeters. Section 7. IUCD and endometrium. Now look at this image. See that bright central structure with a posterior shadow? That's an intrauterine contraceptive device, IUCD. When measuring the endometrium, make sure to exclude any artifacts caused by the IUCD. If accurate measurement isn't possible, it should be clearly documented in the report. Thank you for watching this video till the end. I hope it gave you a clearer understanding of the normal endometrial appearance and measurement on ultrasound. We'll cover more in the next video. So stay tuned, subscribe if you haven't already, and don't forget to check the description for related